Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing as well. This patient, I solved actually his acne, I solved his scars, worked also on his pigmentation. So I did pretty much all those, and then we ended up doing some more with facial balancing for him as well. And we've been slowly doing that, and you can see this is the improvement that we've been able to get. This is about 1 year later right here. Actually, pretty much exactly 1 year later now that I look at it. So he came in today. He comes all the way from Minnesota. Really nice gentleman, very, very kind, who trusted me with his skin, trusted that I could get the best possible results for him. He had done a lot of different treatments beforehand, a lot of different things, and nothing was getting anything close to what we had done. In fact, actually, he had done several things like lasers, as well as he did phenol cross in the past. He did fat transfer in the past. He did so many different things that really were supposed to be like highly effective for scars. But the problem was that he just found that nothing was really getting the results that he was trying to achieve. Found that really the results were pretty mild and barely visible for him. And really what I noticed was that a lot of his scars were pretty stuck very, very deep. And we had to do things to actually break up that scar tissue with subcision in his case. We also really wanted to make sure that we could fix some of the volume issue that was occurring in his face. For this patient, he had done fat transfer, but when they did fat transfer, what ended up happening was that they actually had placed it without doing subcision. So the fat actually ended up kind of going around the fat around the scars. So basically the tethered scars were there, they were pulled down, and then when the plastic surgeon had placed the fat, it didn't go in the layer it was supposed to go in. So that was actually a big problem for the patient. He ended up just really finding that he just didn't get enough of an improvement really, because they should have done subcision first. They also could have done a different way of doing laser resurfacing for him. He's someone who's darker skin type, and he had prolonged hyperpigmentation, prolonged redness, because of the fact that they really didn't do localized for only certain areas. They did it for like bulk heating for like the full face. And then he ended up basically getting more, really just prolonged redness, prolonged pigmentation issues. And so that was another thing he was really worried about. He was telling me, I was worried about doing a laser because it took so long after we did it to get improvement with his skin, because of just that recovery process was a really, really slow process. Emma's saying, do you know anyone in Toronto who could help with acne scars? I do not know anybody in Toronto. I have had a lot of patients in Toronto. Just recently, again, on Monday, I had another patient from Toronto come in. People have been to me for years and years from Toronto. And nobody really ever says that they're very, very pleased with the kind of combination treatments over there or anything. And that's something I definitely have noticed. And I found that there's very few people in the world that do these things at a high enough level really for patients to do it safely. How long do these results take in the picture? So this was actually after 1 full year right here for this treatment. But we did do a few steps. He comes all the way from Minnesota, but we did do a couple things actually for this patient. When he came in the first time, what we ended up doing was we did subcision, we did laser, we did TCA Cross, and then he came in again a couple months later, and then I did some Bellafill for the patient, did some TCA Cross, and then I did a bit of Pico laser actually to help clear up some of his pigmentation. Hi, Resin, how's it going? Hope you're doing well too. And thank you, Sailor Moon. Thanks so much for coming on. So does it get rid of the scars and dimpling from cystic acne? Yes, we improve it. We improve it a lot, actually. That's the thing. Our goal is to improve it. You can see that this patient, for example, he had done fat transfer, but it didn't look like it was cohesive for the patient. It didn't look like it was like his own natural skin, and I should say like his own natural structure. Part of the reason why was because of the fact that they had done it without subcision, without undermining that scar tissue. Moldier is saying, hello, Dr. Qazi, amazing work. What percentage of TCA for TCA Cross do you use in phototype 4 through 5? Well, it depends. I range anywhere from, I do basically 30% all the way up to 80% sometimes, but in Fitzpatrick 4 or 5, we have to be very careful. I usually don't go too strong with that particular demographic. Very, very unusual for me to go particularly strong unless it's a very deep scar and we want to just target that. But I change the concentration depending on the depth of the scars, and it works really well. What's the least invasive procedure to improve youthfulness? Well, you could do things like collagen fillers. That's actually an excellent way of doing things. Collagen fillers work very, very well. So that's why I would recommend. Hang on a second. I think my dog is eating something. One second. There, we saved her. Okay, so she was eating some sort of toy there. Okay, so least invasive procedure to improve youthfulness. One of the best options is really going to be more with volume replacement, like things like Bellafill work really well. Collagen stimulating products, those are things that work out really well. Maine, look forward to seeing you too. Thanks so much. I saw you when you came in. Really do appreciate you. Oh, sorry, when we did the virtual consultation a few weeks ago. So look forward to seeing you too. I know that you're somebody who watches a lot of these lives on TikTok. So thank you so much. Does Bellafill migrate? The way I do it, it's going to stay in this right spot. I don't run into any problems myself. I really don't. There's ways to do it so we could do it safely, and I go deep where it needs to be, and I make sure that it's just tiny little micro droplets, and that's how we could do it so we could do it safely over and over again. There's really, even in my area, there's some people that were doing Bellafill, and people had gotten some issues with it, but I see way less of complications with that compared to with certain hyaluronic acid products like Juvederm line of products. Really, I see a lot of complications with that, way more than I do with Bellafill. And the few patients that I've seen who have gotten issues elsewhere, where let's say there was a lump or things like that, that's things that we can improve still. There's still was hope for it. We ended up doing steroid shot and 5FU. Sometimes I do a little bit of subcision if we need to. Sometimes we could do radio frequency microneedling. So again, there's hope even for like nodules, things like that for Bellafill. But it's never done anything I've run into a problem with. I just go very, very tiny little micro droplets. Does Profilio Cookies and Dreams is saying, or Cookies and Cream is saying, does Profilio run the risk of migration? Any injectable product, any injectable filler could have that risk. Absolutely it could. So just go to somebody who doesn't put too much pressure when they're injecting. What I do is I just do tiny little bits, and I never put a big bolus anywhere. So meaning I don't just blast it or and have a heavy hand. Anybody who gets injected by me knows that I have a really light hand with this. I try really, really carefully to make sure that things are as painless as possible, but it's also so that we don't put much pressure in vessels. And then I'm always moving my needles, moving my cannula, so I don't run into problems there. I see a bunch more questions. I'll try to get to everybody. Thank you so much, by the way, for coming on tonight. Okay, Hero saying, is it true Masseter Botox can lead to early sagging and jowling? Good question. So it's not for everybody. You want to double check to see, is there really jowling evident in the first place? There's laxity right now. Then we might not want to reduce that Masseter. But if you're doing it for for example, for TMJ, if it's just hurting you, it's painful, of course, to get a bite guard, that's one thing that you should consider doing. But the other thing is that you may want to consider doing actually a jawline filler and potentially even chin filler. And then actually also that's something that could potentially help you with laxity below the neck. Sometimes that could also pull back a little bit of the skin along the jowling area. And you don't have to have this large Masseter muscle. You don't have to suffer with that. Leo Rodriguez is saying, are there vegan fillers, injectables, or treatments you recommend? Good question. The Radius is a calcium-based product. It's really, it's not derived from dairy or anything like that, but it's a calcium-based product. So that's something you can maybe consider, because that is just pure natural. It's gonna get cleared out of your system just like any normal calcium will get cleared out of your system. is bound with that, and also a little bit of what's called hydroxyapatite. So that's again just like a natural compound. It's going to be okay to just clear out of your system. In terms of vegan, though, that's I don't believe there's anything that is vegan per se, but Radiesse is probably going to be your closest bet for like a fully natural compound, calcium-based product. You can't really beat that there. What is the procedure for these results? So a few different things for this patient. We did subcision for this patient. We did do, I had to do a couple different ways of doing subcision, though. I did blend cannula subcision, Liberator subcision, also Nokor needle subcision. We also did laser, CO2 laser in this case, and then we also ended up doing some Bellafill for the patient, as well as some more TCA Cross, and then we helped with his pigmentation with the Pico laser, which worked out really, really well for him. So you can see that his skin tone is really evened out right now. He looks awesome. He's really, really happy. Really, really great guy. Awesome gentleman. Comes all the way from Minnesota, and I was telling him today, because like every single time I've seen him, he's just leveling up in life, really. When I first said, I remember him. I told him this like last year, around this time last year is when he came, and he was telling me he was on the flight coming in here, and he said that he felt like he was next to a really beautiful woman, and he just felt really self-conscious, didn't feel like he could talk to her. And, that was sort of like the way that his life has been. He felt that, he's otherwise should be an outgoing type of person, but his scars, he just thinks that people look at his scars and he feels as if that, something that was holding him back from meeting people, holding him back from, being his true self. And then after we did the first step, I saw him again about 3 months later or so. And now he's like really happy, was really excited about the fact that he was seeing someone from his class. And it was like exciting. It was that like he now feels more comfortable and confident, and already was feeling better about it. And then like he felt comfortable enough to ask her out, and then ended up seeing more people, and like he's just like job wise is leveling up. Every aspect of his life he's leveling up, and going on trips and feeling like he's just more social. And she said that he used to just have a lot of anxiety. He was saying that he goes to like anime. He went to an anime convention, and normally he would have felt like really self-conscious, really felt that like people would have been looking at his scars over there. And for the first time he ever went to a conference like that. And now he's saying that like he just felt like he didn't have to worry about it, just was able to relax and enjoy himself. And that's what I was referring to before. Like there's a lot of people, this is one of the people that like really like gives me a lot of like joy in life, because it's really interesting to see like this shift like I was talking about before. This is a patient who is otherwise an outgoing, excellent, amazing guy, and he felt that he was not able to be himself because of his scars. And you'll hear that a lot of times, where people will just think that they just couldn't be like themselves. They couldn't feel relaxed. They had like this buzzing, this distraction that was around them because of the fact that they had scars, and they felt that people were looking at their scars. They felt they were uncomfortable. There's this discomfort there. And it's a really amazing process, really, over the course of 1 year, you could see. And, I promised him like basically that this is going to take 1.5 years to 2 years. We're almost there right now. 1 year later, it's this is where it's at. And another 6 months to a year later, it's going to be even better. So it's awesome. It's a really, really great, remarkable way of improving things. And each time we're seeing him get better and better, just like socially, and like feeling like he's just himself now. And it was robbed of him. He did a lot of things though. He was, at a young age, he did a lot of treatments, did fat transfer, did laser, did phenol cross, and did so many things, actually, a few times. And it's a sad story that I hear over and over and over every day. But then you see it like 1 year later, and it's like, wow, here we are. We're getting there. We're getting really close, and you feel like patients feel really good. It's like, I want that. That's exactly what we're trying to achieve. This was Period is asking, what did I do? With a few different things with this patient. We did Taylor Liberator subcision, Nokor subcision, which is basically sharper tools to break up the scar tissue. I did TCA Cross as well for the patient. We ended up also doing some laser to resurface for his skin. And then we also did some Bellafill injections as well. Those all worked out. And then I cleared up some of his old pigmentation with the Pico laser, which worked out really well for him. I think it was a really, really great idea for him to trust me to help me clear up his old pigmentation, because it was like, you could now see that the scars actually themselves are better, but sometimes there's these little dark marks that are there, and people think there's deeper scars there because of those marks. And since we smooth them down, everything looks really, really nice now. Kim K is saying, hi, sir, what's a quick way to help stubborn PIE? At-home treatment recommendations, please. The easiest thing to start with is just 10% azelaic acid. It's an easy product to just you can pick up over the counter. So consider that. So something like that. And appreciate you, Resin Tail. Appreciate you. Thank you so much. Resin Tail saying that the results look really nice, and that this is just amazing to hear a story for this patient. And Resin did a treatment last week and healing really well also. So appreciate you. What's a cheap treatment for acne scar? Retinoids are probably the cheapest thing you could consider. It's probably the cheapest thing. It may not help too much, but it could help though. La Jenny is saying, you definitely boosted my confidence, loving my treatment for my acne scars. Appreciate you, LA Jenny. If you haven't already, please write a review for me. I would really appreciate it. It'll be really helpful if more of my patients do that. I appreciate you coming on here and doing it. But if you could just take a moment, it always is really, really helpful. We see so many people, and it really would help out if more people that we treated gave a notice and let the world know that what they did is just, you guys are real people. I showcase it all the time. It's just really, really nice. But I appreciate you so much for that. And hopefully, I saw you and we have a good game plan for you for the future there. Cookies and Cream is saying, how do I determine if I need ultrasound devices or filler or Kybella for more defined jawline? Good question. I mean, so you can actually see for this patient today, actually, you'll see later on, but I worked on his jawline. So you can see it is a bit recessed over there. See how it's essentially it should have been a bit of a sharper angle at the jawline, and now I balanced it out really, really beautifully, and we'll see his results later on with that. But it's awesome, actually. So think of it like this, that if there is this bone recession, you should really be able to feel your bone right here really easily. You shouldn't have to push down. And if you're pushing down, it probably needs some sort of volume over there. And that's where you need something like jawline filler. If you're looking at your neck and if you're looking at it and there's this fullness there, likely it needs some sort of thing like liposuction. I do micro lipo. If you feel it and there's a little bit of laxity there, it's a little bit looser, you may need to do something where we go internally, heat the skin, something called FaceTite and NeckTite that could heat and contract the tissue, or you may consider even doing surgery for that. So all options really should be on the table with this, because we want to make sure that you could get that chiseled neck without wasting your money. You said Kybella, and I would say that's not going to really be too helpful for a lot of patients, because it could actually leave you with looser skin afterwards, and that's not great. So I would recommend doing something more for skin tightening, directly removing some of that. Mulder is saying, thank you for the answer. Our clinic is thinking about buying the Cure laser, but is it worth the hype? Does it really work as good as isotretinoin? Well, it works very well. It works really well. I was interested in some option outside of isotretinoin for patients, because I knew that it was taking a toll on some patients. There's people that they can't do isotretinoin, and they really do need something to help with their moderate to severe acne. So it works just like that, really. It's awesome because there's no other side effects. Just localized to the face. People could go about the rest of their life, their day, without any downtime, any recovery. So it's awesome, actually. It feels really good, actually, for me, because I have an option for people that, they may be suffering from acne, but they also were worried about the consequences of isotretinoin Accutane. And it's there was no real great options for people. I was an Accutane 3 times. It works, but it took a toll on my body for no question about it. What's this one called? This is a combination session initially with what I did with Taylor Liberator Subcision, regular Subcision, Nokor needle, all that same time. I did TCA Cross as well. I did laser. I did ablative CO2 laser, fractionated erbium laser. I did about 3 months later, I did some Bellafill for the patient. And we also did some more TCA Cross. I believe there was 4 sessions total of TCA Cross for him. And then also about 3 to 4 sessions of Pico laser for him. And good seeing you on, by the way, Sonia Carr. Let's see, Boxy Doxy saying, I have visible pores and can tretinoin reduce those. I think mine is genetic because nothing seems to work. It can help with the oil production, and then that could help reduce the scars a bit there because the oil dilates the scars. So yes, it could help with that part. The tretinoin could potentially be an option for that. What can I use as aftercare for CO2 laser? Well, the CO2 laser, if it's done like right away, you do want to make sure that it's clean. There's not going to be any bacteria on the surface of your skin. So the water, and there's a lot of moisturizer and sunblock is typically what I do, but it depends on how deep someone does. Sometimes we also, if we go pretty deep, I use like silver creams as well. I use, that's like, it helps as an antimicrobial. Sometimes we could use steroid creams also to help prevent hyperpigmentation. So I'm not sure how deep and or anything of that nature, but that's usually a lot of it. It's a lot of aftercare for CO2 is like moisturizer, sunblock. That's like the biggest things there. Does at-home blue LED light help with inflammatory acne? It's I don't know if there's enough evidence that will showcase that has enough energy for it, but it's probably okay. It's probably okay for people. It's just I'm not sure if there's enough energy that they usually have at the at-home devices there. Do greeny or yellow lasers help with acne? Well, yellow lasers can help a bit with it. It helps a bit with the vascular component of it, but it's definitely not the go-to. It's not like the number one treatment really for acne. Active acne, really, there's not many too great options for lasers. Of course, you could do like 1064. It does clear it out. The blue, I use BBL. That helps as well. But, the problem is that it's pretty expensive if you're using like lasers directly at it, and it's like just a short-term, it's just a short-term fix really. So you want something longer lasting. JA is saying, how urgent is doing HCG or pregnancy test before recommending retinoids? What is the physiology behind their teratogenicity? Good question. So vitamin A is in general considered to be toxic for fetuses, but especially ingested. So that's why like isotretinoin is highly contraindicated for anybody who's pregnant or planning a pregnancy. You have to be in 2 forms of birth control if you're on it. Topical retinoids don't have that kind of risk like that, where people would say that you have to be on 2 forms of birth control, but you're correct that you do want to make sure that you're not pregnant while actively using it. Topically, it's going to be low likelihood of it really penetrating enough to cause damage to the fetus. I don't know if any guidelines, at least that I've last checked, of saying that you have to do any pregnancy tests before or during using retinoids. But certainly, if you discover that you're pregnant, you shouldn't be using retinoids, and you could switch over something like azelaic acid. I could double check to see for you if there is something that's like more up to date about if we need to do any more pregnancy tests, anything like that. But as far as I've known, I've never heard of anything like that you have to do that, because there's really low likelihood of it penetrating. It's just that once you discover that you're pregnant, you really should make sure that you stop that and use something else, potentially like azelaic acid, for example. Thank you, HJ. So HJ is saying this is an amazing result and appreciates you for that. Let's see. Why do scar results take longer for some people than others? That's a really, really good question. Really, really good. I mean, it depends on a lot of different factors. There's, this patient, for example, he did everything that I wanted him to do. I mean, that's part of what happened here. And, he did a lot of treatments beforehand. He understood this world, understood what was involved, and he just wanted to do. He just told me, he came all the way from Minnesota just because he just wanted to get the best possible result, the best possible treatment, and he was just willing to do whatever it took now to get there. And that involved a few steps. Really, it involved us first breaking up the scar tissue, remodeling some of the scar tissue on the surface, and then having him come back, doing some Bellafill, doing a little bit of more TCA, and then helping with his pigmentation. He did have a little bit of hyperpigmentation after his lasers, some redness after his laser, but he just understood that was okay. He followed along the instructions, and we were able to get there. That's really important. He just had. There's a lot of patients out there that I have that kind of mental fortitude, really. It takes a lot. It's like, I think, there's a lot of people on here that are watching who are my patients who I see their names. They don't even have scars. A lot of people are on here. They just look at this and just to kind of see what this world is like. And they're very supportive of it. They're very supportive of patients who go through this, and they understand that there's like this whole journey involved. but there's other people out there that just don't understand what it takes. It takes a lot. It takes a lot of strength, really. It really does. It's really tough actually for people. It really is. And there's times when, it may be too much because of everything else going on. There's external issues. My patient the other day, she had a good result. It was good. I didn't do any volume replacement or anything like that. But I did about a year and a half ago a procedure on her combination session similar to this patient. And then we were supposed to do volume replacement afterwards, but then she got pregnant. So now I can't do volume replacement. So we waited till afterwards, appropriately. And but she was going to see me. But 2 months after basically having a baby or so, now her husband's telling her that he could see her scars, and he's just like, I still see scars. And she just had a baby, her weight fluctuated, things like that. And I thought that was a really terrible thing. I thought that was a really terrible statement, really. And I know, I'm not sure if you're on here right now, but like I told you that was a terrible thing that he said to, really. And it's like, sometimes you hear that, you see that there's like this external noise that people have. The people that really a lot of times do the best, honestly, the people that really get the best results are those who have really supportive families. Really, a lot of times that's like the best way. Sometimes it's interesting actually. The people that feel like they have a supportive family that could get them through this process, so that they could go through this journey and really and do it really appropriately. This patient, like for example, and resin tail right down here. She drove all the way from Texas. I forgot how many hours you said you drove. It was like 7 or 8 hours or so. You came in with your husband the first time, and it's Arnold gets you on, by the way. I was just talking, and basically Resin Tail was talking about how her husband was so supportive, and Resin Tail's results are amazing. So it's like it's awesome. It's like part of that is that, and then you have some people like this where it's like everything's going well. She had a baby and she lost weight from the baby, and then her husband says that I see scars, and like it's devastating. It's like, first of all, she's saying she was in her car and like the light is shining on there and everything like that, and then she felt that she was really depressed about the whole thing, and then it's like it gets people like really down, and it's like that depression could be really problematic for people, because now it's like they may not be able to go through that full journey now, the rest of the steps that need to be done. And it's sad, it's a sad situation. It's a sad thing that there's people out there that try to crush other people like that. I don't know why you would need to I've never in my life would ever comment on my wife like that. Like I just never would do it. And like just whatever's happening with why would I ever do that? It never would cross my mind to. And so many men would, it just doesn't make sense. So I'm not sure. And especially she just had a baby too. It just doesn't even make sense. So, but there's a lot of people like that, unfortunately. David's saying, what's the procedure that was done in the picture shown? So this was with Taylor Liberator Subcision. So I broke up the scar tissue with some blades and with blunt cannula and with something called a Nokor needle. This was with TCA Cross as well. And then we also did a laser to resurface the area. And then subsequently, we did some Bellafill for the patient and more TCA Cross. Okay, let's see. F.V. Aloza is saying, where was the question here? I missed it now. I answered your question earlier. I can't remember where it was though, but if you could just repeat your question. Guys, instead of saying I didn't answer your question, if you just repeat the question, I'd be happy to help you out though, but it's really impossible because there's so many questions on different platforms. It's really hard for me to then go and scroll and find where your particular question was. Just ask again. And just kind of relax. I'm on here Monday to Thursday on purpose for that purpose. And if I missed it, it's okay. I'll try to get to yours. I really will. But sometimes I miss it. So just feel free to re-ask it and I'll be happy to help you. Just Living Life is saying, what do you think of high frequency wands? It's funny. I actually just saw an ad for that. One of those. It was Jessica Alba using something like that or something like that. And I can tell you, I don't think that's the reason why her skin's great. And that's why she's her skin is tight. I'll just put it that way. There's a lot, I can't say because I don't use it. I don't know. To me, there doesn't seem like there's much evidence for it or anything like that. But sure, I guess if you want to drop the money, there's just a lot of better options out there than something like that. There's just a lot about it. I'm not even saying you have to necessarily do big procedures like this, but you could just do topical retinoids, sunblock, and start there and see where that takes you. And it could end up being really, really great. I'm 42, almost 43 this year, in just a few months. And I've never touched those things. So it's I don't know, just saying, like, like I don't know how much you really need to do like that's like beyond like some of these basics. To be honest with you, sometimes you could do like some lasers, energy devices, awesome. But like, do you really need to do like high frequency wands? Like I said, I saw this ad. It was like just literally a little while ago, just like before I came on, and she's like going over her face with this, and like that's not the reason why her skin is that tight. I don't know how old is Jessica Alba, but her skin looks great. I don't think it's because of this wand though. Let's see here. Shamaz is. Oh, I already asked you this. Where was it? Any tips for JA is asking any tips for matching IM? Well, definitely the biggest thing is going to be to like really hustle on the floors and in the unit. So hopefully you did all that, because it's really not too bad. Then once you get that, you get some really strong letters of recommendation, you're going to be fine. Like get the people that are like the directors and work and make sure that like, so for myself, when I was in residency, like that's how I've been in life forever. Like it's just like I made sure that like there's nobody ever who could say I was lazy ever. Like that was just the biggest thing for me. Nobody ever could ever say to that like Nadir Qazi was like a lazy dude. So it was like my whole thing was that like no matter what else, like I'm gonna make sure I'm never lazy. So like that meant like I would actually read a lot. I would actually do everything else I need to do, understand the patient a lot, and like if I had to like go there earlier to go figure something out, I would do that. So I just did everything it was that like just whatever it took just to make sure that like I like out hustled and like got everything down for everybody, and everybody knows that. Like I was just walking around the hospital, like I just knew like my patients very, very well, and like know your patients extremely well. Like just like really know them and really understand them. Shaman is saying how to fix dark elbows from leaning too much on the table. I don't think it's just regular hyperpigmentation anymore. Well, it's still hyperpigmentation from post-inflammatory hyperpigmentation typically. So you probably would want to actually use something more like easy option could be just Eucerin's anti-pigment cream, or if you're able to get a prescription for hydroquinone for a few months. But the other thing you may want to consider is actually using silicone tape over there. Actually, that could actually help it as well. Fiona is saying, hi, Dr. Qazi. In your experience, is there a noticeable difference in how fast you could get results in patients in their early 20s and early 30s? Yeah, the speed of it could matter with age, potentially. This particular patient is 24, but we ultimately can still get there. It's just that you're right, it may take a little bit longer, not necessarily in the early 30s. I don't think there's that much of a difference, but 50s and 60s, it may take a little bit longer. And by longer, I mean like instead of like, 6 months, it could take a year and a half or so, sometimes like that. And some people, like depending on the oil production, it may not, it be as fast. So there's things like that we pay attention to. Look forward to it. Pang Pang is saying that they can't wait to do my online consultation. Look forward to that. What you could do is just everybody that's on here right now, you could schedule online consultation. Just go to drqazi.com and our prices are on there. We could schedule that for you. We'll be happy to see you actually. So feel free to do that. And for those who are my patients, there's so many patients of mine right now. Actually, I see a lot of my patients, which I really appreciate. If you could just leave a review for me, I really would appreciate that. Thank you so much. I know Resin, I saw that you did that. Thank you so much, by the way. Amru is saying, I have ice pick scars done with 6 sessions of CO2 laser, but never worked for my skin. Collagen is not being affected. Yeah, ice pick scars, you may have to do like just what I did, TCA Cross over here. We may have to do excisions. There's other things that we may have to do for that. Dina Rose is saying, what is the average price for a treatment like this? Most patients spend about $5,000 to $7,000 on their scars, but there's some patients who have a lot of scar tissue and a lot of volume loss, and it could then be anywhere from $10,000 to $20,000 for those patients, depending how much volume loss there is. It's just it all depends on what we're dealing with. But most patients $5,000 to $7,000. Vast majority of our scars are around that I would say. There's a lot of people that have deeper volume loss, deeper issues, and then of course, if they want more of that polished look, that as close to polish as possible, it's going to cost more. It's going to take a little bit longer for us to get there. How many sessions from the left to the right side? I guess I'm missing the question, but this was a few sessions, about 3 or 4 sessions of TCA Cross. We did one tailor Liberator subcision and regular subcision with it that day. CO2 laser. Actually, I think I did CO2 laser twice. Actually, I did it. Let me see here. Let me just double check. Did I do it twice? Yes, I did like focal spot. I did mostly full face one time and then focal spot one more time actually. So and then I did some Bellafill for this patient. Sima is asking, hello, do you know anyone in New York? I know it might be difficult for you to see patients in New York. I have a CO2 laser. I can't have CO2 laser because I have melasma. Can you suggest something else? So I have a lot of patients. Actually, this week I had 3 patients actually from New Jersey and then also from New York to total. So that's 3. And they were darker skin type. They're Fitzpatrick 4 and above. Actually, one of them was Fitzpatrick 6 as well. And really, I don't know anybody who does darker skin types. Really, in New York City, surprisingly, I don't know anybody that does the darker skin types, actually. And there's very few of us in the world that do scars, very, very few of us. It's, a lot of people would think, oh, well, almost anybody could do these things the problem is that maybe they could do one of something, maybe potentially like fat transfer or something like this. But this patient, he got fat transfer from somebody who didn't do subcision. And then it ended up really causing it to get lumpy. It wasn't actually, great for his skin. He wasn't loving the result. We had to do subcision. And he was shocked by how much scar tissue. I don't know if you're still on here, by the way. I saw your name on here. I didn't want to call you out though for it though. But, that's what you were telling me. You were saying that the subcision, it shocked you because there's so much scar tissue. You thought that they should have done subcision or they were supposed to do subcision, but there's hardly anybody that does subcision. There's hardly anybody that does it really well. One of my patients today, actually, she had done so many lasers, so many CO2 lasers. She came all the way from North Carolina today, and she was told by her dermatologist that she doesn't need subcision. It's different. This is the thing. This is the problem that I have. So it's, this is actually I'm going to be ending tonight, just a couple of minutes here, but I want to say this, that there's a difference. Do you actually need something? Or is it that they can't do it? Okay. So I think people should be clear that this is something that I'm not particularly comfortable with. I don't do enough of, but there is maybe another way of doing this. That's a different way of saying it. But it's not fair to say that you don't need it. There was so much scar tissue in these rolling scars that the patient had, these deep boxcar scars that she had. There's no question that she needed subcision. There's just no question she needed it. And in fact, she should have had subcision before she did all those treatments. Actually, she wasted a lot of money. Sorry, I don't mean to maybe it helped with her texture, but I mean that she could have gotten a much better result if she did subcision. I don't want to make people sad about the things they did before. I don't want them to say that they wasted the things because maybe it did do some things for them, but it wasn't solving the problem that they were having. And that was these deep scars, and there was so much scar tissue. She knows exactly what I was talking about. Sometimes she comes on here too, and it was deep, thick scar tissue. I broke it up, did a very effective job in breaking it up. We worked incredibly well with that. And it's really kind of wild when you actually think about it, that this person told her, this dermatologist over in, I think she said it was in DC area that she was going to, who was claiming that she didn't need subcision because her scars weren't deep enough. They were so deep. Actually, I don't even know of how much deeper you could get. It was almost down to the bone for some of those things. I don't know what would be deeper than that. They're so deep. They were so stuck. So, again, that's something just if you're going through these consultations, you're double checking things, just see is this something that the person just doesn't do much of? When it comes to these scars, there's lots of different ways of doing it, and there's a reason why I may not do it. And there's certain things that I will have my partner, who's a plastic surgeon who does a lot of scar revisions herself, and there's things that I may have her do because it's this surgical scar needs to actually be excised, and then you just need to do this redone and make it tighter. I'm not going to be able to do that. But I'm not going to look at this and claim, hey, what we should do is just do 6, 12, 30 lasers right now, and that's going to solve this for you. That's just a really inappropriate way of doing things, and which is why I wanted more of a comprehensive platform here. I wanted people to actually, when they come over here, that we are going to be able to solve this at a very, very high level. And we can really do this very, very well. There's, I actually haven't encountered scars that we can't solve. So it's not difficult really for us to be able to find some sort of solution. And there is a solution. There's actually, surprisingly, all these problems have solutions, way more than people think. So there's a lot of ways to do it. Let's see here. I'll answer this one here. Shar is saying, I have anxiety and I know you don't use numbing cream. My treatment is in 4 weeks. What could go wrong with nerve injections? Good question, actually. So I do so much of it every single day. Let me first explain the reason why I don't do numbing cream. And it's really important, actually, because I believe, like, for example, for this patient, what would have happened is that some of his scars, his deeper scars, would have had a bit of micro swelling with that topical numbing solution, the numbing cream. And it's very difficult then to just go and actually smooth it down the way I need to smooth it down, because it's like, I don't know what's really truly the scar tissue, how deep it's supposed to be, what's actually the micro swelling over here. From just the anesthetic. So that's why I don't do it. But the nerve blocks work incredibly well. We don't run into any problems with it. I am very careful as I inject it over there. There is a possibility, because it's a needle, that if you really just shove it really deep inside there and like just really just like, using the wrong gauge needle as well, that you could potentially damage the nerve. I don't know if there's any literature showcasing that's like a permanent damage or anything like that, but that's something that would be a theoretical risk. But really, anybody who's ever done it for me knows I never shove anything like that. So it's like I'm not like going in there and with the needle and poking this like that. Like I'm very, very slow and precise as I inject there too. So I hear you with your anxiety, though. We could give you anxiety medication. And look forward to in 4 weeks. The topical numbing isn't going to help with the anxiety. They're just not going to feel pain anyways. We could, by the way, if you want, we could do like, you could request it. Actually, my team could help you if you want. We could put a little numbing along the spots that we're going to inject. If you want to do that, that's fine. We could do that. So let us know. Just come a little bit earlier for that. We could put like little topical numbing cream in those spots. So you could ask for that, by the way, if you really were worried about that. I'm going to end right now, but I'll just answer this last thing. Ida's asking, how long did it take to get these results? This was exactly 1 year later. 1 year later result there.